Tafamidis treatment for patients with transthyretin amyloid cardiomyopathy. Definition. The definition is transthyretin amyloid cardiopathy is caused by deposition of transthyretin amyloid fibrils in the myocardium. The deposition occurs when wild type or variant transthyretin becomes unstable, the midfolds. The Tafamidis binds to transthyretin, preventing tetramer dissociations and amyloidogenesis.
Transthyretin amyloid cardiomyopathy, ATTR-CM for short, is a condition in which a protein called transthyretin folds abnormally in the body, forming amyloid. Amyloid is an abnormal substance that the body does not break down normally. Amyloid can build up in the heart, causing the heart walls to become thick and stiff. This reduces the heart's ability to pump blood around the body and increases the risk of heart problems like heart failure. People can inherit ATTR-CM from a parent, or it can develop with age. Over time, ATTR-CM becomes worse and can lead to heart problems and death. Tafamidis is a medicine approved to treat people with ATTR-CM. It reduces the buildup of amyloid in the heart and other parts of the body. Tafamidis was initially available as a 20 mg capsule. People could take a 20 mg dose, 1 capsule, or an 80 mg dose, 4 20 mg capsules. More recently, Tafamidis has become available as a single 61 mg capsule with the same effect as an 80 mg dose. Tafamidis was approved to treat ATTR-CM based on the results of a study called ATTR-ACT. Overall, 441 people with ATTR-CM took part in this study. 106 people had ATTR-CM that was inherited, and 335 people had ATTR-CM that was due to aging. People were randomly split into 3 groups to take an 80 mg dose of Tafamidis, a 20 mg dose of Tafamidis, or a placebo once a day for up to 30 months. A placebo looks just like the study medicine but does not contain any active ingredients. After completing ATTR-ACT, people could choose to continue taking Tafamidis as part of an extension study. In this still ongoing study, people who originally took Tafamidis continued to take the same dose. People who originally took a placebo started taking either 20 mg or 80 mg of Tafamidis. After July 2018, everyone in the extension study switched to the new single 61 mg capsule of Tafamidis with the same effect as Tafamidis' 80 mg dose. Researchers looked at how well each Tafamidis dose worked compared with placebo in the original ATTR-ACT study. People who took either dose of Tafamidis were less likely to be admitted to the hospital for heart problems and also lived longer than people who took a placebo. After taking either dose of Tafamidis, people were able to walk a longer distance in 6 minutes, an indication of how well their heart was working. People were also less likely to report that their condition made their quality of life worse. In ATTR-ACT alone, researchers did not have enough information to find out if the 80 mg dose worked better than the 20 mg dose. However, the extension study has provided the researchers with enough information to make this comparison. In this additional time, half of the people had taken Tafamidis for at least 51 months. The risk of death was lower for people who took the 80 mg dose of Tafamidis than for people who took the 20 mg dose. People who took the higher dose of Tafamidis were 30% less likely to die than those who took the lower dose. People who took tafamidis in ATTR-ACT and the extension study, regardless of the dose, were no more likely to experience side effects than people who took a placebo. A side effect is something either expected or unexpected that people felt during the study. The researchers had two main conclusions based on these results. First, both the higher and lower doses of tafamidis worked better than placebo in reducing people's risk of being admitted to the hospital for heart problems and of death. Secondly, the 80 milligram dose of tafamidis worked better than the 20 milligram dose in reducing people's long-term risk of death. As such, 80 milligrams of tafamidis is the preferred and approved dose for treating people with ATTR-CM.
And the applications in medicines, the tafamidis is being used in a patient with a transthyretin amyloid cardiomyopathy in order to achievement, a reduction in all-cause mortality, and improve the quality of their lifestyle.
So this week, on May 6, 2019, we got some very exciting news. The medication called Tafamidis, that's Tafamidis, was approved by the FDA for the treatment of ATTR cardiac amyloidosis. This is the first FDA-approved treatment we have for patients with TTR amyloidosis who have heart involvement, period. So this is historic. We were with the clinical trials from the beginning, spanning back to at least 7 years ago, and to see all the brave patients who enrolled in this trial, which included placebo-treated patients, but that we finally have an FDA-approved medication for this disease is really exciting. I think that now all these patients who are diagnosed with this disease, they're going to have an option. And furthermore, we're hoping that this option will be affordable through assistance programs. We don't know exactly how much this is going to cost for the individual patient, but again, we're very hopeful that this is going to be made affordable. The good news is now that we have tafamidis, we may have more medications coming in the next couple of years for TTR cardiac amyloidosis. There's going to be clinical trials with other agents that work directly on the liver, and then every year we're thinking about newer ways to treat this disease. But indeed, May 6, 2019 will be forever etched in my brain because it was actually quite emotional for me to see, and it's very emotional for our patients. To finally see an FDA-approved medication for TTR cardiac amyloidosis. There's no difference between the traditional drugs because there were no traditional drugs. So tafamidis binds the TTR protein. It's called transthyretin. It binds it and prevents it from breaking apart. And that protein breaking apart is the initial step to forming amyloid deposits in the heart and or nerves. So tafamidis is what we call a stabilizer. It's stabilizing that protein. The large trial that showed its effectiveness in TTR cardiac amyloidosis was called the ATTRACT trial, ATTR-ACT. It was published in the New England Journal in the fall of 2018. It's 441 patients. About more or less half got placebo and more or less half got tafamidis. And they followed patients for 2.5 years. And at the end of 2.5 years, there was a significant survival benefit for those patients who were on the tafamidis for those on placebo. There was overall less hospitalizations for the people on tafamidis, and their quality of life declined much less slowly than it did in the placebo group. What's important to tell patients about this is that this will slow down the disease considerably. It doesn't cure the disease. It doesn't reverse the disease. But the results of the ATTR-ACT trial were quite impressive. They actually exceeded our expectations. And so I think that the survival of these patients will significantly improve with it.
And pros and cons. The pros, it increases the life expectancy of the symptom of the diseases and therefore decreases for mortality rates produced by this one. It reduced the cardiovascular related hospitalization in patients that suffer from transthyretin amyloid cardiomyopathy. And cons, the treatment takes long to see the benefits. The benefits, the urine in the patient that consume it, and approximately 30 months. There were some adverse events that emerged during treatment, like diarrhea and urinary infections, but they were generally mild to moderate in severity.
We had recently very important advances in this because one drug, the name is Tafamidis, has proven to be extremely effective in patients with transthyretin cardiac amyloidosis. This is an oral drug that is very well tolerated, so it's a real, I would say, innovation in the field. The drug has been developed by Dr. Jeff Kelly, and again, it came from basic research. So the limiting step of this type of amyloid is the dissociation of this tetrameric precursor protein into monomers. So the brilliant idea was just to inhibit this dissociation by stabilizing the molecule with a compound, because this tetramer has a kind of hole where it binds usually thyroid hormones, and the occupation of this hole stabilizes somehow the molecule. So from this concept, the drug was developed and has proven to be rather effective in patients with polyneuropathy first, and then now we have the evidence that is useful also in patients with the cardiac involvement.
The ISU applied in Ecuador. This treatment can help reduce mortality rates in the patients that suffers transthyretin amyloid cardiomyopathy. Here in Ecuador, increased their life expectancy and improving their chance of controlling the symptoms involved in the diseases.
This animation is specifically about ATTR amyloidosis. To understand more about amyloidosis or learn about other types, go to the Amyloidosis Research Consortium website at www.arci.org or www.arci.org.uk. ATTR amyloidosis is caused by the misfolding of a protein called transthyretin, or TTR, which aggregates and deposits as amyloid in various tissues and organs. TTR is mostly made in the liver. Once released into the bloodstream, its role is to transport vitamin A and the hormone thyroxine around the body. In order to do so, 4 individual TTR proteins must be attached to each other to form a 4-unit complex before it can carry vitamin A or thyroxine. In ATTR amyloidosis, the 4-unit complex is made up in the normal way, but is unstable and prone to breaking up. In some cases, this is a result of inheriting a mutation in the TTR gene, which gives rise to TTR proteins that don't fit well together. This is known as hereditary ATTR amyloidosis. In other cases, the individual TTR proteins become altered as we age. But what causes this to happen isn't known. This type is generally referred to as wild-type ATTR amyloidosis. Once apart, the TTR proteins have a tendency to misfold and aggregate to form fibrils, which deposit as amyloid. TTR amyloid deposits are most commonly found in the heart, where they cause cardiomyopathy, and in the nervous system, where they cause neuropathy. Deposits can also be found in the digestive system and kidneys. As the amyloid builds up, it starts to disrupt the function of affected organs and cause symptoms. Treatment is aimed at reducing TTR production or at stabilizing the 4-unit complex. Until recently, a liver transplant was the only way to stop TTR being made, but novel treatments including gene silencing technology are being used as another way of stopping the body from producing TTR. Drugs which stabilize the 4-unit complex are also being used as a way of reducing the chances of TTR misfolding and forming amyloid. The hope is that gene silencing and stabilizing treatments can reduce amyloid formation, help existing deposits break down naturally, and in doing so, restore organ function and improve quality of life for patients.
Conclusions. In patients with the heart failure due to transthyretin amyloid cardiomyopathy with Tafamidis, reduce all-cause mortality and cardiovascular-related hospitalization, and as compared with the placebo, Tafamidis is treatment also. Thank you.